Okay, we're going to start with the resting hand splint, and you want your patient to be in a relaxed position. The wrist is in about 20 degrees of extension. And I already kind of pre-cut this. The pre-cuts that they sent ran a little bit large, so I'm making this just a little bit smaller for Scott. And normally the doctor would put a bulky on if he's sending you down to the clinic. And so we would just put the splint right over the bulky with a little stockinette on it. And you can see the thumb is jumbo gigantic, so we don't need it to be that long, but that's okay because I can just trim that off. So back to the bulky, you would have the bulky on, then you put the stockinette on top of that, and then you would just go ahead and, when you take the splint off, go ahead and cut the stockinette off with the bulky so that you don't take the doctor's dressing off. How's that feel?
Good.
Good, okay. This is Tailor Splint, and it took about 30 seconds to heat up. And what happens is when you turn the whole arm over, the muscle belly changes in the forearm mass, and so it's important that for the last couple of seconds, when you're making, that's still too limp, so for the last couple of seconds when we turn it over, we're going to make sure that he's in pronation, so that's really how he's going to wear the splint at night. If it was a CVA or a stroke patient that you're making the splint for, obviously they're going to have a lot of flexor tone. So what I like to do is just make the wrist component first, and then ace wrap that on, and then I do the thumb and the hand component second. And I don't use the Tailor Splint, I use the Orthoplast because it's a little bit firmer and it's going to hold the tone a little bit better, and you can also put some dividers here. So I can feel now that that feels nice and firm, and so what we're going to do is we're going to work together and turn the arm over. And I'm going to make sure he brings his wrist back just a little bit, right? And I'm going to make sure this fits him just like it's supposed to. And it still, you can tell, needs to sit up for just a second. So what I can do is take, I can either spray the cold spray on there, you can go ahead and come on out. Or this is the completed splint. You can still work with it just a little bit and mold it. And while I have it, I know that thumb was way too long, so it's still nice and easy to trim up. And we can trim off the thumb right there. You can also bring the wrist back just a little bit, so it's still very moldable at this stage. Doesn't exactly fit my hand. Let's go ahead and try that. Good. So that's the most important position that you have him in, to make sure that he's comfortable there. That's poking into him there, so you can easily roll that out. Okay, you can come on out. And to finish the splint off, I would go ahead and trim this edge up, make that softer. And you might even, where he put this on his thumb, roll that back just a little bit. You don't necessarily have to do that. But then the patient themselves, they can either push this in or pull this out to make it more comfortable. And that's the resting hand splint.